Hi, I'm Abhay Gupta. I'm a board-certified plastic surgeon practicing in San Diego at Gupta Plastic Surgery. Thanks for coming to our website. As you can see, this is a collection of some videos that I have to answer some of the common topics I get asked about in plastic surgery, some of the common questions I get asked at during consultations, some of the misconceptions that are out there in plastic surgery. In this video, I'd like to talk about facial aging, some of the changes that happen with aging, and the treatments that are available to help reverse those effects. It can be pretty confusing. There's lots of different treatments out there. You'll read every day different ones in magazines and on the news and on the TV, different celebrities touting different creams and different products, different machines. So it certainly is very confusing, even for us as plastic surgeons. The easiest thing I can say is that to think about skin aging or face aging, it happens at two different levels. It happens in the skin surface and it happens underneath the skin surface. There's two very different aging effects that go on, two very different types of treatments that are available. There's no single treatment that magically treats both the surface of the skin and the tissues underneath the skin. Unfortunately, it doesn't exist, and often the best treatment is a combination of multiple different types of treatments to get the best result. In terms of what happens on the skin surface, you get primarily is sun damage. That's the most prevalent aging factor that's out there is the sun. Easiest preventable treatment of that, the easiest way to prevent that is sunscreen. It's cheap, it's cost effective, something you can easily do every day. Other than that, though, you have to look at the effects of the sun or the effects of skin surface aging to see what the best treatment is. What happens is the skin dries out, it loses its water content. You get a little more dryness in the skin, more dead skin cells, pigmentation spots in reaction to sun damage. And so the skin surface aging treatments are designed at removing those top layers of damaged skin. Ways that we can remove the pigmented lesions, the dry, flaky, damaged, brittle skin, and get the youthful, more younger layers of skin, the smoother, shinier layers to grow up to the surface. And there's a wide range of treatments ranging from the least invasive skincare products you put on your face every day, up to chemical peels, or to a more effective treatment is laser surgery. Something we do regularly here at Gupta Plastic Surgery. A laser will remove those top layers of skin, get the younger layers of skin to grow towards the surface and be more visible, makes the overall face look much smoother. The laser will also activate the collagen in the face. One of the things that happens as you age is your skin loses collagen production, loses elasticity, so it's not as it loses that bounce back feature, and so the laser will activate that, increase the elasticity of the skin, and help tighten your skin to reverse some of the sagging. What happens underneath the skin surface? So underneath the skin surface, you get dryness of the tissues, you lose water content, which leads to hollowing. You get sagging of the tissues due to gravity pulling the tissues downwards. And so overall, the face tends to sag on the face. There are several ligaments in the face that hold the skin to your facial bones, so your face doesn't completely sag off your face. And what happens is these ligaments stay attached, the tissues sag, and then the ligaments form these deep creases. Often you'll see it here at the eyes, you'll see it here in the cheek, here in the marionette line, in the neck. And those creases become the hallmark of deeper facial aging. How do we correct those? Well, that's more designed at correcting the hollowing in the tissues and lifting the tissues. We can correct the hollowing in the tissues using soft tissue fillers like Juvederm or Restylane or Sculptra. We can fill in the areas that are hollowed by the drying of the tissues, and the more plump we get the face, the more youthful it looks. You can fill in the direct creases in the cheeks or in the eyes, again get plumping and lifting of the face, and can have a reasonable effect. For the more advanced aging, unfortunately, it won't really make a significant difference, and then you're looking more at surgical treatments to go in surgically underneath the skin, and lift the tissues of the face back to where they belong and put sutures in to hold them in place. And that's what a facelift is, or a neck lift, or a brow lift, or an eyelid lift, is a surgical correction. Definitely more invasive, but definitely much more effective at the more advanced aging changes that you'll see. So if you look at facial aging in terms of skin surface versus deep underneath the surface, you'll see there's a spectrum of treatments for both, and ultimately comes down to how advanced your aging is, what the quality of your tissues are like, and what needs to be reversed to decide what the best treatment is for you. I hope that's helpful. I encourage you to check out the rest of the videos on our website. Again, www.guptaplasticsurgery.com. And look forward to seeing you in consultation in the office. Thanks very much.